upper limb, arm, ROM, muscle strength, coordinated activity, hand, loss of prehension, sensation, strength, lower limb, mobility component, ROM, muscle strength, stability component, PPI of upper extremity. Guidelines for evaluation of PPI upper extremities. Estimation measurement shall be made when the clinical condition has reached the stage of maximum improvement from the medical treatment. Normally, the time period is to be decided by medical doctor who is evaluating the case for issuing the PPI certificate as per standard format. Upper extremity is divided into two components, arm and hand. Arm and hand. Impairment of entire extremity depends on the combination of impairment of both the components. Total disability will not exceed 100%. Disability is to be certified as whole number and not as a fraction. Disability is to be certified in relation to right of extremity. Arm upper extremity component. Total value of arm component is 90%. Principle of evaluation of ROM of joint. The value of maximum ROM in the arm component is 90%. Shoulder up to 20, elbow 20, wrist to 10, hand up to 40. Dependent upon extent of involvement, mild less than 1/3, moderate up to 2/3, severe almost total restriction. If more than one joint of upper extremity, loss of percentage in each joint is calculated separately as said and then added together. Average normal range, shoulder flexion 0 to 180, extension 0 to 50, abduction 180, adduction 50, internal rotation 80, external is 90, elbow flexion 150, extension 0, forearm pronation 80, supination 85, wrist flexion 80, extension 70, ideal deviation 20, ulnar deviation 50. Thumb CMC abduction is 70, flexion 15, extension 20, abduction 70. Opposition tip of thumb to base or tip of fifth finger. And thumb MCP is 0 to 50, thumb MCP is 0 to 50, flexion, thumb IP flexion 0 to 80, digit 2 to 5, digit 2 to 5, flexion 0 to 90, extension 0 to 30, PIP flexion 0 to 90, DIP flexion 0 to 90, hyperextension 0 to 10. Principle of evaluation of strength of muscle. Strength of muscle can be tested by manual method 0 to 5, Medical Research Council MRC London UK, depending upon the strength of muscle. Loss of muscle power can be given percentage as follow. Mean percentage of loss of muscle strength around a joint is 0.3. If loss of muscle strength involves more than one joint, then mean loss of percentage in each joint is calculated separately and then added together